Now, what about the signs and symptoms? Chest pain, tearing, radiating to the back. Doc, whoa, this thing hurts. On a scale of 1 out of 10, 10 being the worst pain that the patient has ever experienced, it is a 10. Radiating to the back. Severity and intensity, sudden onset because whoosh, dissection. What about the patient's unequal blood pressure? Where? I just told you, it's robbing the blood because of the dissection. It's removing the blood. Not removing, but you're losing the blood, literally. Unequal blood pressure in both arms due to dissection. Obstruction of branches of the aorta. You have issues there because of dissection. Look for that, please. Diagnosis made by CT, and on this particular CT, you'll notice right in the middle where there's a tear of your aorta, resulting in blood quickly leaking out and resulting in all kinds of issues, including that unequal blood pressure between the arms, to the point where maybe there's a pericardial cavity effusion, or in other words, rapidly there might be tamponade. And that's exactly what the middle portion of the CT is then showing you. Diagnosis. Control blood pressure, usually ICU, IV nitroprusside, and perhaps you're thinking about Esmolol or other IV beta blockers because you are trying to control that bleeding that is now taking place quite a bit. You don't want that cardiac output to be quite high because that is then going to then contribute to the blood being lost through the dissection. That must be understood. You want to relax the heart so that you have control of the dissection. Medical management. Now, the only one that I'll point out here to you will be the Stanford type B. Where am I? The descending aorta. In other words, it's not the ascending. A is ascending type of dissection. The B is the one that you pay attention to, the type of dissection. It's a persistent pain, persistent dissection, which then requires immediate surgery. A, ascending. B, distal by the thoracic and descending aorta.